Okay, so now continuing with our assessment of the head and neck, we stopped at the palpation of the head and the palpation of the temporal artery. So we're going to continue now with the temporomandibular joints, and we're going to go ahead and palpate those. Now, those are those joints that are located anterior to the tragus of the ears, right here. And we're going to ask the patient to open and close as we feel. And we can even try to do a lateral motion. Now, when we try this, what we're looking for is any pain, crepitus, locking, or popping when we do that, which could be indicative of a temporomandibular joint dysfunction, noting that snapping or clicking is not unusual. So let's go ahead and move forward with the palpation of the salivary glands. Now, the salivary glands are located within the mouth, and we need to note to see if they are asymmetrical or enlarged. So we need to palpate to determine whether they have discreteness, whether they have mobility, texture, or are tender. So we're going to go ahead and ask this patient to go ahead and open his mouth, and then once we do this, we can take go ahead and take a fork or a spoon, or maybe even a cotton wisp, and we can go ahead and try to express material from the salivary duct only when you find that it is enlarged. For example, go ahead and lift your tongue up. We can go ahead and try to press down and see if we can get anything out. In this case, since we do not have enlargement of the glands, we will not see any material excreted at this time. But however, if we did see an enlargement of one of the glands, it would be diagnostic of an infection or maybe a ductal stone that is blocking the saliva from being excreted. We also want to check to see if there are any nodules that can be indicative also of a cyst or tumor. So now moving forward to percussion and the auscultation portion of the assessment. Normally these types of assessments are only done when certain disorders are thought to be possible in a patient. For one, in cases where there's a possibility of hypercalcemia, there's a percussion of the masseter muscle. Now, if you have a hyperactive reflex, this is something that you would call a Schwarzkopf sign, and that would be indicative of the hypercalcemia. However, percussion of the skull if you would show a low pitch, would be indicative of hyperparathyroidism. Now, auscultation of the temporal region over the eyes, which would be in this area, we would take our stethoscope and using the bell, which this one does not have a bell, but if it did, we would place it right over the temporal region, and we would try to hear for a blowing sound, which we call a bruit. And that would be indicative of a vascular anomaly or a cerebral aneurysm. So we're going to go ahead and complete this video now, and we will continue with the next video with the assessment of the neck.